In supporting teens with special needs to become safe drivers, I think we, as podiatrists, really look at it twofold. We look at how can we use therapies and adaptations on the patient side to help them be more functional on their own. And then we also look at how we can modify the environment, so in this case, the vehicle.
Our program offers our teen drivers one-on-one instruction behind the wheel. We also offer the ability to coordinate with the mobility dealers for adaptive equipment that's necessary, but most importantly, coordinating with the state of Illinois to make sure that the students, these are new drivers, are meeting their requirements for licensure.
So when we're looking at the driving skills of teens with special needs, one of the first things that we look at is their thinking skills. That will use intensive neuropsychology testing to look at how they think and what kind of actions and things they would choose in certain situations, and that can be helpful in terms of looking at safe decision making. And then our therapist counterparts sometimes will help with things like reaction time and scanning the environment and looking for any areas of neglect or visual neglect. We have a specific visual device that we can use that actually will look at the visual field and visual cuts or areas that they might not be paying as much attention to, and then teach them to use cues to attend to that area in particular.
Occupational therapists are both certified driver rehabilitation specialists as well as certified driving instructors with the state of Illinois. We're allowed to complete the required behind-the-wheel training for a student to obtain their licensure.
As a certified driving rehabilitation specialist, it's considered a gold standard that allows us to work with absolutely everybody in the driving rehabilitation population.
Occupational therapists specialize in understanding these different types of diagnoses so we can cater our driving experience or training towards their individual needs.
Typically, the clients we will work with have sensory processing disorders, ADHD, or anxiety. Some of these teen drivers may also have congenital disabilities such as cerebral palsy or spina bifida. We will provide one-on-one behind-the-wheel instruction. Prior to that, we put them in the car as a passenger and just work on identifying hazards and see what they're processing, speed, what they're noticing in their environment. And then when they're ready to get behind the wheel, we'll typically work on one task at a time until they demonstrate competence and are able to move on to more complex situations. And also provide education too in the family and how to deal with the equipment in terms of the appropriate equipment that goes in the vehicle in the appropriate places, and that they are using what's typically called a NMETA certified dealer. So this is a national mobility equipment dealer that has safety standards. So many people do not understand the complexity of that process. So we will be the liaison between driving rehabilitation, the mobility dealer, as well as help the client then with vehicle modification get to the Secretary of State for the relicensure or licensure phase.
We had a young man who was actually in the referral specifically stated that he expected the vehicle would need significant modifications. And for this young man, in spite of the fact that he had quadriplegic CP, so involving all four extremities, significant abnormal muscle tone in all four extremities, was actually able to drive it with really minimal modifications and able to be safe and control the vehicle effectively. I think several aspects that really make a program like our Teen Drivers program successful is that multidisciplinary teams, and then also just really having good parent investment. They have to really have the full support of their family, and so making sure that that's all kind of incorporated into the plan for them is what really makes it successful.